Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. Long-term hormone therapy may affect metabolic health of transgender individuals. New research from Karolinska Institute shows that long-term sex hormone treatment in transgender individuals can lead to significant changes in body composition and risk factors for cardiovascular disease, particularly in transgender men. The study is published in the Journal of Internal Medicine. The researchers followed 17 adult transgender men and 16 transgender women who were prescribed treatment with testosterone and estrogen respectively. They used magnetic resonance imaging to map body composition and measured metabolic risk factors via blood test, blood pressure and vascular stiffness. The scans were conducted before the start of the hormone therapy, after 1 year and after 5 to 6 years. The results show that long-term hormone therapy leads to several major changes in both body composition and metabolic risk factors, particularly in transgender men. The changes in fat volumes continued over time, while the greatest changes in muscle mass and strength occurred after just 1 year of treatment. Can low advantage neighborhood lead to worse outcomes for kids with multiple sclerosis? People who develop multiple sclerosis as children and grow up in less advantaged neighborhoods may have a larger volume of inflammation and brain tissue loss on imaging than those who grew up in more advantaged neighborhoods, according to a study published in the online issue of Neurology, the Medical Journal of American Academy of Neurology. Our findings suggest that social disadvantage in childhood can have lasting effects on multiple sclerosis severity, said study author Kimberly A. O'Neill, MD of New York University Grossman School of Medicine. Childhood is a critical time for exposure to environmental factors associated with increased susceptibility to multiple sclerosis, such as passive smoke, pollution, and low sunlight exposure. More studies are needed to understand which and how factors in disadvantaged neighborhoods increase the risk for multiple sclerosis severity in young people. The study involved 138 people with an average age of 20 who were diagnosed with multiple sclerosis before age 18, known as pediatric onset multiple sclerosis. They had been diagnosed with multiple sclerosis for an average of 4 years. Study highlights the heterogeneity in insulin needs among people with type 1 diabetes. Factors beyond carbohydrates have a substantial influence on blood glucose levels, meaning current automated insulin delivery system miss vital information required for glucose regulations. A new study has found. A team of researchers from the University of Bristol analyzing automated insulin delivery data from people with type 1 diabetes discovered that unexpected patterns in insulin needs are just as common as well-established ones. This study, published in JAMA Med, aimed to identify patterns in changes of insulin needs and to analyze how frequently this occurs in people with type 1 diabetes who use the Open APS, a state-of-the-art automated insulin delivery system. Reduction in cervical cancer mortality in women under age 25. JAMA study finds. Cervical cancer deaths have plunged dramatically among women under age 25, and researchers at MUSC Hollings Cancer Center believe this is likely due to HPV vaccination. The study, published in JAMA, studied the impact of HPV vaccination on cervical cancer deaths. We observe a substantial reduction in mortality, a 62% drop in cervical cancer deaths over the last decade, likely due to HPV vaccination, said senior author Ashish Deshmukh, PhD, co-leader of the Cancer Prevention and Control Research Program in MUSC Hollings Cancer Center. We cannot think of any other reason that would have contributed to such a marked decline. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.